Hi, my name is Zhiwei Chen. I'm the professor and the director of the AIDS Institute at the University of Hong Kong. As everybody knows, since the discovery of the AIDS virus, AIDS vaccine research has always been the first priority in the field, but up to even nowadays, we still do not have a very effective AIDS vaccine for clinical use. The reason why AIDS vaccine is so difficult is related to several factors. First of all, the virus is highly mutable and it generates a lot of immune escape mutations, which makes the vaccine very, very difficult for protection. The second reason is we still do not have a good animal model for testing the vaccine because HIV itself cannot infect any small animals so that we can easily test the vaccine efficacy. Then the third major reason is because the vaccine test requires a huge amount of resources because this investment, due to the lack of the animal model, we have to test the efficacy in human beings themselves. So this is the reason we have to secure like thousands of people for vaccine testing so that we can see the efficacy effect. But every single step combined together, that makes the HIV vaccine very, very difficult to be developed quickly. Well, this is a very challenging question because currently there's several large clinical trials ongoing right now. And one of the very promising vaccine actually was published a few years ago. The trial conducted in Thailand showing the vaccine has 30% of efficacy. On top of this, and scientists already made a lot of efforts trying to improve the vaccine itself and also try to repeat this type of vaccine, see whether they can be further improved. So nowadays, there are several very large phase 3 trials ongoing, and hopefully if this vaccine works, then in the near future, there might be a preventive vaccine being invented. Personally, I do believe there's a promise for AIDS vaccine development. And this is based on the scientific evidence, especially the large clinical trials being conducted, showing some promise like 30% protection already. But after the vaccine already being further modified, optimized, and improved, hopefully in the near future, and this vaccine will see even better clinical efficacy. In terms of the time, because several AIDS vaccines already in large phase 3 trials. And currently, we still do not know whether those vaccines works or not. If they are working very well in terms of the preventive effect, and then as soon as this large trial being finished, there's a chance for real use of the vaccine in the human population. So the time-wise, if this vaccine works within 5 years, then within 5 years, we will have a vaccine for further human development.